Hi and welcome, it's Jen from drjenbasir.com. If you have neck pain, then today's video is for you. We are going to talk about two particular aspects of how you can heal your neck pain. We're going to talk about the physical component, and then we're going to talk about the underlying emotional component of it as well. In the 20 years or so that I worked as a physical therapist, I learned that my patients who got better were those who were allowed to or were capable of and interested in talking about the underlying emotional issues that they had that were going on in their lives at the time that they were dealing with their physical problems. And so it's very important to address not just the physical pain or symptoms that you're having, but also the emotions that you're dealing with surrounding that experience as well. Of course, if you are currently receiving treatment from a doctor, a physical therapist, a chiropractor, or some other medical professional for your neck pain, then please follow their advice and what they are telling you to do. So let's talk about the physical aspect of neck pain. You have a pretty sensitive structure when it comes to the neck. All of the sensation and the strength that you get in your arms comes from the nerves that are coming up from the vertebrae within your neck. Your neck has to have good alignment and flexibility so that you can have movement that you need within your head, which allows you to get a bigger view of the world through your eyes, to move your ears so you can hear things from multiple directions. So you need good flexibility in your neck. You also need good alignment in your spine so that you can have that freedom of movement. You have the bones themselves, the vertebrae, and those can start to degenerate over time. You have the nerves, like I said, that give you the sensations that you get into your arms, and those can get inflamed and have pressure put upon them and give you problems in one or both of your arms. And then of course you have the muscles that provide the structure and the support that allow you to move your head. And then within the neck itself, you have your throat. And so when you think about the emotional aspect of neck pain or neck problems, you can think about how that might be related to expression and what we want to say or verbalize in terms of what we're feeling. So from the standpoint of physical pain, problems with the neck, if you've had whiplash, if you have headaches, if you have difficulty breathing even, these things can all come from the neck itself. And regardless of the particular structure that is at fault or the problem that you're having, in all cases, we want to try to restore normal alignment and normal positioning within the neck itself, because that will, of course, allow you to then have optimal movement and flexibility within the spine. And most people don't have this optimal alignment in their spine because most of us tend to have poor posture, in part because we spend so much of our time either sitting at a desk now or just being sedentary overall. We're not nearly as active as most of our ancestors were. And what tends to happen is we get in this slouch posture and our neck is sitting like this. And that position in itself over time can cause problems. You can start to get headaches, especially from that position. You start to get tightness in the muscles in your chest, which can eventually make it more difficult to breathe. It can make it harder to swallow, and it can limit the motion that you have in your arms. And then, of course, if you have problems with your discs or with your nerves, and you have symptoms going down into an arm, if you're in a position like this, that is just going to make those symptoms worse. So regardless of what structure is at fault and what problems you're experiencing, there is one particular exercise that I love, and I actually do this myself every single day because it helps to restore the normal alignment and height that you need within your neck. Your vertebrae, when they're in good alignment, they create the space that is necessary for those discs and for your nerves so that they have room to breathe, essentially, and to provide you the strength and the function that you need. By the time you reach the end of your day, you are actually shorter than you are when you first get out of bed in the morning. And that's because the discs are very fluid filled and they start to lose their height from all the standing and sitting we do all day, which just causes more and more compression. So regardless of the problem that you're having with your neck, if you can restore more height, more space for those vertebrae and for the discs and for the nerves, you can have less pain in your neck and potentially in your arms if that's what you're experiencing as well. So my favorite exercise for the neck is one that actually involves creating better alignment in the entire spine. Most people that have poor posture, it's not something that's just limited to the neck, it also involves the rest of the spine. And usually there is weakness in the abdominal muscles. So we end up having our pelvis and our low back out of alignment, and that cascades all the way up. So it's not going to get rid of the problems in the neck if you just focus on the neck, if you also have misalignments that go along further on down the spine. So the reason I love this exercise is because it corrects the alignment of the entire spine, which then allows the neck to sit in a better position, and then therefore the head to sit in a better position. So this exercise requires you to find a nice clean spot where you can lie on the floor. So you may or may not be able to do this at work. And you also want a firm surface. Most beds are going to be too soft. You're going to want to lie on the floor, and you're going to lie down on your back, bend your knees up so that your feet are flat on the floor, and then let your arms rest at your side with your palms facing the ceiling. This position is called hook lying, and when you turn your palms to face the ceiling, it helps to open up some space in your chest. And you just want your arms at a comfortable distance away from your hips. So lie on the floor, on your back, bend your knees so that your feet are flat on the floor, and let your arms rest a comfortable distance from your side with your palms facing the ceiling. And just lie here for a few minutes. You will notice probably that when you first get into this position, there's a lot of space between your low back or your belly and the floor, and between your neck and the floor. Now, your spine isn't going to be completely flat and pushed against the ground, but after a little bit of time sitting in this position, you will probably notice that those parts of your spine sink down a little bit closer toward the floor. And what I like to do as well in this position is just kind of tilt my pelvis back and forth a little bit, and then lengthen up through my entire spine. And you can take the base of your skull and just very gently, give it a gentle push back toward the floor. Now, like I said, I love this position because it gives you better alignment through your entire spine, and so it allows the neck to relax. So the muscles can relax, and those discs can now have more space, and you will get less pressure on the nerves, so that if you have problems going into one of your arms, those symptoms can be reduced just by getting into this position. While you are in this position as well, pay attention to your breathing and notice if you're breathing just from your chest or if you're breathing from your belly. One of the other problems that we have when we have poor posture is we restrict our chest, and we tend to do a lot of breathing just from our chest. And so we end up taking shallow breaths, and that kind of plays into this cycle of the neck pain, the bad posture, and the poor breathing all going together. So in this position on the ground, just practice taking some nice, slow, deep breaths, breathing from your belly, so that when you inhale, your belly is going to rise, and when you exhale, your belly is going to sink back down toward your spine. So this is my favorite exercise, my favorite physical exercise to help with my neck when my neck is bothering me. It's a great thing to do if you can during the day once or twice, especially if you're sitting a lot all day. So that's the physical side of dealing with neck pain. Now let's turn and talk about the emotional side. Every area of our body where we experience pain or other symptoms has underlying potential feelings or beliefs that contribute to the cause of that physical pain. Everything that we experience in our physical body starts first as a thought or a belief that we have. And then we attach feelings and emotions to these beliefs, and then it manifests in our physical body. So if you can get to the underlying feelings or beliefs related to the area where you're having pain, then you have another avenue to help you find healing from the issue that you have going on in your physical body. So the neck is specifically about stiffness, inflexibility, and being stubborn. And as you think about the inflexibility and the stiffness, that can also be related to the throat, the avenue of expression, the ears, what we hear from other people, and the eyes and what we're able to see, because the neck is important for all three of those things. So if you are inflexible, if your neck is really stiff, that means you have a hard time turning from side to side. And I want you to think about this in terms of viewpoints and opinions that other people might be offering, or that you maybe need to consider in some area in your life. If we are walking down a road like the horse with the blinders on, then you're only going to see what is directly in front of you. If your neck is really stiff and you can't turn it from side to side, then that means that the underlying emotional or perceptual pattern, if you will, is about only seeing what is directly in front of you and only seeing one point of view. So having stiffness means that you're not willing to incorporate other opinions or other viewpoints because you're not willing to turn in that direction to see, to hear, or to listen, to express what someone else is saying to you, or what maybe you need to verbalize to other people. So the question then is, in what area of your life are you being inflexible in terms of listening to another point of view? Where do you need to potentially consider that something else might be true as well, or that it might be good for you to take in another point of view? Now we can expand this a little bit further and look at whether your motion is really stiff going to the left side or to the right side. There's a difference between the left and the right side of the body. And in most people, the left side is the feminine, which is the receiving side, and the right side is the masculine, which is the giving out side. So for example, if you're really stiff turning your head to the left, but not to the right, then that might indicate something about your relationship to the feminine or your ability to receive something. If you're really stiff to the right, then it might indicate a relationship to the masculine or to a particular man in your life, or your ability to give out, to express a particular point of view. Now, all of these options are not necessarily going to be true for you. So what you need to do is take some time to sit down and ponder upon these things for yourself. So what I recommend doing is getting out a notebook, taking even just 5 minutes in your day, quiet time by yourself, and ask yourself these questions, and just tune in and listen to the answers that come to you and what you feel is going to be true for yourself. Where in my life do I need to be more flexible in hearing different opinions or allowing other opinions to come to me? Another question you can ask is specifically related to how we talk about the neck pain that you might be having. And a phrase that you often hear is, that person is such a pain in the neck. So in this case, you might want to ask yourself, who is it that I think is being a pain in the neck? Who do I not want to hear, or what do I not want to hear? And just ask yourself these questions and see what comes to you. And then when you get your answers, slowly incorporate some of these changes into your life, and you can see how that will have an impact on your neck pain. Repeat to yourself the belief and the idea that you are willing to listen to different viewpoints, that you are willing to listen to maybe this particular person who you feel like you're being stubborn toward. and see how that impacts the pain that you've been having or the stiffness that you've been having in your neck. So the neck pain is just like any other physical symptoms that you may be having. We have the physical side of it, and it's always good to think about addressing things in that nature as well. So do that exercise lying on your back. And then you have the underlying emotional side as well. And so think about what this belief system is that might be playing into your neck pain, and see what you can do to resolve those issues in your life, and use both of these things together to find relief from your particular challenge that you're having with your neck. I would invite you to try this process for yourself, and I would love to hear in the comments below what you have found as you have investigated the underlying emotional component of the problems you might be having with your neck. Have a great day, and share this with any of your friends who you think might benefit as well.